I think everyone's seated, so welcome this evening. I'm Nathan Boyle, the President of the AIDS Council. I'd like to thank everyone for being here. Tonight you can see outside that it's getting quite stormy and fierce, and I'm hoping that wind and energy will come into this room for a pretty intense debate on a really important topic. Before we commence, I'd like to acknowledge the traditional owners of the land that we meet on this evening and pay my respects to the elders, both past and present. The Council also has its own elders, those people who are positive, who worked in the community, who protested, advocated for change and supported people affected by HIV and AIDS. So tonight we're very fortunate to have some great speakers. I'll introduce Nick here to my right. He's now become a bit of an idol, from what I understand, from his interactions on Q&A. So we've had to talk to his management team and bring him up here on a VIP jet was the requirement. We also have here Dr. Takmeen Sue, who's a wonderful GP who I'll introduce later, who's renowned by many people, and the interchange practice is a fantastic place in the ACT, and many diverse people use that, so it's great to see some really local practices supporting diverse communities. And of course, Keiran, one of our top staff here at the Council as well, will also have a brief introduction. Tonight we are going to do a bit of Q&A session after our presentations. I think tonight's really about a debate, so I don't expect there to be a consensus after tonight or one position discussed by our speakers. Rather, though, I think it's about putting all the information out for discussion. I'm really grateful again to see ACT Health here with officials. I think it's one, they fund us, so thank you for that, but two, officials are coming to these events outside of work times to engage and to listen to the community, and I think it really reflects the ACT government's commitment to the community's voice to be heard. And obviously, I'm not expecting ACT Health to have any position here tonight, but it's a reality though, government needs to form positions around these issues, but I think we've got a really good, strong support network within government here to be part of that conversation, and we have other allied health professionals here too. So first I'd like to commence with Keiran, but actually before I do, just please turn off your phones. We have a wonderful social media guru here who's recording this for us, who can also assist you in your own businesses if you need help, so approach her later, and just to minimise any disruption for that. So I'd like to first introduce Keiran. Keiran's been a long-time worker with the AIDS Council, and as from what I can see here, has many varied occupations in the organisation, really emphasising working on gay men's health, their access to information, knowledge, and making informed choices. He'll give a brief introduction discussion about what is PrEP and what does it mean for us, and that will then lead to our other keynote speakers. So please warmly welcome Keiran.
Thanks, Nathan. Let's just check that this is actually working. Yes! It's been one of those days, it's small things to get you through. So thanks everyone for coming along to our first ever PrEP forum. Keeping the conversations going on since the AIDS 2014 conference down in Melbourne in July this year. So I get to do kind of the backgrounding, and if everyone wanted to know what the AIDS Action Council's official position on PrEP is, I think the best I can say at this stage is watch this space. And that's why we're starting to have a dialogue with the community. We're in a process of starting to accumulate the data. We're talking with our peak bodies, we're talking with other AIDS councils, research organisations, and now we're starting to engage the community here in Canberra about what we know what PrEP is, but what does it actually mean for the ACT? So just because we know what PrEP is, doesn't mean that we've necessarily done a very good job of communicating what PrEP is to the community. And I look at my own social media feeds, and I see all sorts of chatter going on. I see everything from people who are well versed in it. I have people who either are from America or are very closely attached to people in America, where there's a very different culture around PrEP, and where it has actually been part of the response to HIV since May this year, to all the way through to vague looks or people not understanding or having any idea what PrEP is. So, what is PrEP? Pre-exposure prophylaxis, in this case specifically for HIV, and the particular regime in Australia, it would be Truvada. Truvada is tenofovir and emtricitabine. to buy. I can never get that one. Tucky will have to save me later with that one. And these are both nucleotide analog reverse transcriptase inhibitors, or NRTIs for short, and that just is a particular process in the how they affect HIV and the replication process of it, which even at the council I don't even really need to know what that is. So, but that, just for people playing at home and any trivia buffs out there. Is it controversial? Yes, just a little. This is actually a conversation that started about 2010 with some articles that came out in the New England Journal of Medicine, and where some evidence was starting to show that the use of HIV medication, because if I go back, Truvada is an antiretroviral. It is medication that we currently give people who are living with HIV. If you include one more drug to Truvada, it becomes a tripler, which is one of the more common triple combination therapies that people living with HIV have access to here in Australia. So this conversation has been going on at a research level since about 2010. Since then, there has been a little bit of research on the ways that pre-exposure prophylaxis could be applied. That research has been done with men that have sex with men. It's been done with heterosexual men and women, just with heterosexual women, and with injecting drug users. And there's been varying results. The evidence amongst for the effectiveness amongst gay men has been some of the strongest. The evidence amongst heterosexual women, unfortunately, has been some of the weakest. But that's not necessarily because it's not going to work, but because of some of the other psychosocial and the other issues around implementing these things, even getting the drugs out. A lot of them have taken place in developing countries, parts of Africa, where there's actually more benefit to people living with HIV or who are scared of getting HIV to sell those drugs onto people who are already living with HIV, or concerns around, what does it mean if people actually find those drugs in their medicine cupboard, and the word getting around, even though they aren't currently living with HIV, and that it is only part of a trial. So we have found so far that there is some good evidence that that Truvada is quite successful, but what does it take to be successful? So if it's in the oral Truvada is actually one of the more effective, and these are some of the studies. I won't bore you. I'm not going to do death by PowerPoint, but this is more just to demonstrate that there is actually a lot of evidence out there. And some of the research is showing that that if it's taken frequently enough, that it can have up to 99% effectiveness with stopping HIV transmission, all things being equal. What's the more recent history? So in 2014, in May this year, the United States Centre for Disease Control approved access to Truvada as a form of PrEP, but the release over there was quite different to the way that we envisage it working here in Australia. In America, it's actually a really slow take-up as well. Probably only around 2,000 scripts. Tuck, does that sound, Nick, is that right? 2,000. Yeah, and around 50% of those are actually women. And we're not quite sure yet why there is. There's a lot of ideas around that, and more evidence will be coming out over the next few months. We're not looking at having such a broad access to it here in Australia, because I think the epidemic here in Australia is quite different, and potentially this is something that would eventually be covered by government, potentially, through the pharmaceutical benefits scheme. In America, most of it's being covered by insurance companies, so as long as the insurance company approves it as one of their drugs, then they should be able to cover it. In Australia, we're primarily looking at gay, bisexual and bisexual men and men that have sex with men, anyone who's been diagnosed with syphilis in the previous 6 months, injecting drug users, and anyone with a regular sexual partner who's currently living with HIV. With the emphasis actually at the moment being on gay men, because bang for buck, that's where the epidemic is, and that's where, if it's going to work, it's going to have the most effect. So people are often are wondering how effective it is. 99% effectiveness if there are 7 doses a week, 96% with 4 doses per week, and 76% with 2 doses per week. The evidence as to how long you have to take it beforehand is a little shaky at this stage, but the way that Truvada works in its half-life, it does hang around in the body for a little while, and so it's not something that necessarily has to be taken 7 days a week, because there is always concerns about the adherence and what are those things that get in people's way for taking it, and what can stop that. Things like the cost, particularly if it is not going to be covered by the pharmaceutical benefits scheme. And I'll look at some of the alternative methods that it could be used. Adherence is difficult with fixed interval and post-coital dosing, so the 4-dose minimum a week seems to be have the most traction at this stage. So what does HIV actually look like in Australia? What is the context that we're talking about? So as of the end of last calendar year, 35,287 people have been diagnosed with HIV in Australia, with an estimated 26,800 of them still living. And there have been approximately 6,846 deaths attributed to AIDS-related illnesses. I've just put up here in the slide the data for Australia cumulatively. In the 12 months from 2012 to 2013, there were 1,236 new HIV diagnoses. 76% of those, 76 I think, were amongst MSM. In Canberra, we've had a cumulative of 399 infections, and this is according to the Kirby Institute's data, so blame them if it's inaccurate. Unfortunately, I don't have the cumulative data to break down to male and female for that, or what percentage of those are currently MSM, what we call men that have sex with men. But last year, we had 24 diagnoses of HIV in the ACT, 20 of which were men, and 16 of those were, it was identified as having come through male-to-male sexual contact, and 4 of those were women. So it should be noted, even though we do talk about this being an epidemic that is predominantly amongst gay, bisexual men and men that have had sex with men, that there are still people who don't identify as that who are being affected and diagnosed with HIV for a range of reasons. So that's just a bit of the background for the context here. Side effects are something that's also often asked about, and there have been some reported side effects. Headaches, abdominal pain, and weight loss from Truvada. Around 2% of negative men have reported those who've been using PrEP. And amongst long-term users of Truvada, so far the only data we have for that are people living with HIV, there is evidence of liver and renal failure, and around a 3 to 4% decrease in bone mineral density. So, and there haven't been any adverse effects from mother to child breastfeeding. It's been a long day. I love technology, and here's the breakdown of the data for diagnoses here in Australia. This is what happens when you try and do too many things at once and your staff are on leave. So what does PrEP mean for, in the context of trying to end HIV? Now that we know what it is, how it possibly works, and some of the concerns around side effects. With ending HIV, we hope that HIV could be, diagnosis of HIV, particularly amongst MSM, but hopefully within Australia altogether, could be finished by 2020. As part of that, the Ending HIV campaign was developed first in New South Wales and is currently being rolled out, and some of you may have seen posters of this. If you've been to Cube Nightclub, The Ranch, we've started putting in some of our materials, such as our newsletter and that sort of thing, on our website, front and centre on our front page. So there's a trick if anyone recognises it from our website. But one of so there are 3 pillars to that. Test more, treat early if you do become HIV positive, and staying safe. So staying safe isn't just the condom and lube message, that is still an integral part of the response to HIV. But these days, particularly when talking about gay men, it's bigger than that, and it's more complicated than that. There are other risk reduction strategies that are being used, and it seems possibly being used quite effectively. There's serosorting, where guys are determining, based on serostatus, and these are alternatives to condom usage. Serostatus, so you finding partners of like serostatus, pos, neg. Strategic positioning, where the HIV positive person is the receptive partner. Negotiated safety, so talking to your partner and discussing around testing, discussing what you know about HIV, your STI status, and that also leads into undetectable viral loads if your partners or you or your partner have HIV, trying to get onto treatment and getting an undetectable viral load, which according to the partner study, I believe that was, has shown, a large cohort study earlier this year showed that no individuals in that became HIV positive, and that was across thousands of participants over a number of years. The only people who became HIV positive in that sample were people who had sexual partners outside of the study. The withdrawal technique, which is not one that we would recommend, but is certainly part of the overall discussion, and PrEP. And PrEP is what came before PrEP, which is the post-exposure prophylaxis. And PrEP does fit in with staying safe. And for some guys, choosing to use PrEP is the preferred method for taking control of their sexual health. And I'm sure Nick will be able to go into much more detail around what that could look like, or does look like at the moment. But we often hear, what about risk? This is just a free-for-all, guys don't have to use condoms anymore. Well, actually, the research is starting to suggest that guys are certainly not going to take any more risks. There might be some initial fantasies around taking more risks, but the studies are showing that there's actually often decreased risk-taking behaviour, or certainly no more risk-taking behaviour than previously. Sometimes the number of sexual partners are decreasing, sometimes the use of condoms is increasing. And like I said, sometimes initially when they go into the idea of the fantasy and what this might mean, but the reality isn't actually playing out. And partly this is because it's possibly bringing the HIV front and centre into their mind and being proactive. So we don't see this as being singled out on its own. This is part of a toolbox. It's part of a range of ways that people can address HIV. And at different times during people's sexual lives, they're going to have different tools that are effective for them. And for some people, using PrEP might be the most effective thing. So there's a range of responses people have had, but it doesn't look like risk-taking has certainly become an issue from it. And the seroconversion study, I think this is really important. The seroconversion study in 2013 showed that with nearly all the new diagnoses, no risk reduction strategies were used at all. So what that says to me is that the use of any risk reduction strategies is better than none. So I think that's enough for the backgrounding, the boring bits. Hopefully the interesting people are about to come up. Thank you Nick Hollis from the Institute of Many coming along. Thank you Dr. Tuckmeng Su from the Interchange General Practice. Thank you Jenny Atkinson from Trans Australia and your fantastic support. She's the one who actually got all this electrical stuff going for us. I'd probably be weeping in the corner right now if she hadn't come. And also we had some support from Northside Community Services. Thank you very much everyone.